What's been fascinating is that we have evolved as a professional community, and more we understand that if we don't work together on behalf of women with breast disease, then we are not really serving their needs. And so that education that we offer each other multiplies exponentially what we're really able to bring to women on behalf of disease control, cure, supportive quality of life. We cross-fertilize each other and in that way enhance everything that we do. We try to make sure that professionals understand that our obligation is not obviated because we are not appropriately reimbursed. We need to continue to fight for that is best, and that means to fight for, one way or another, either breast centers within walls or breast centers without walls because of the way we set up our communications with each other, that woman can count on the fact that there are not just many disciplines attending to her, but they are doing so in an integrated fashion. And we need to continue to fight for that concept staying alive on behalf of women. When we work together in a multidisciplinary way, in an interdisciplinary way, as I've said, we discover that we bring out the best that we possibly can. And we co-educate and we cross-fertilize and cross-pollinate and all of those good words that can happen in the field. The reason ASBD really strikes to the heart of that is that everything we do starts from that point of view. Every program that we put on, every regional symposium that we put on is always with all of the disciplines being represented. And that includes what gets left out sometimes, the whole issue of psychosocial, psychosexual, psychological recovery, because quality of life and moving into survivorship must be a part of what we talk about when we talk about caring for the woman with breast disease, caring for the woman with breast cancer. It all has to be there. And American Society of Breast Disease remembers that. And I think that's why we have been resonant to the needs of our constituency, our memberships, and therefore resonant to the needs of women. The issues for women that fall into the emotional sphere for them once they hear breast cancer, once they have to go through treatment, adjuvant therapies, the issues are big. And they have to do with the whole human being that is going through the experience and the whole family and the whole social circle of the woman who's going through the experience. Because all of them are impacted by the diagnosis. And so those of us who are in the more psychosocial sphere, if you will, stand to learn from our more physiologic colleagues much about the biology and the physiology of what the woman has experienced, and we are in a position to share with them the rest of what the woman is going through and the resources that are available to help women as they look to recover. To say that a woman is free of cancer doesn't mean that she is truly cancer-free, because the idea of being a person who had or has cancer, that is with her and impacts her whole life in every domain. And so that sharing between those of us who attend to those issues and my colleagues who attend to the diagnosis and the treatment and the adjuvant therapies, that sharing between us makes all of us better at what we do. There are groups who, in some fashion, give recognition to the multidisciplinary nature of care. What I have liked about ASBD is that it is both a comprehensive and a consistent dedication to multidisciplinary care. And so even in controversial issues, there's no shying away from the fact that the disciplines must be at the table together. That's kind of how ASBD has been distinct from others that have gone into multidisciplinary issues with some regularity. ASBD has been consistent and stalwart in making sure that we hold ourselves accountable, hold our own feet to the fire as professionals to keep multidisciplinary always in front of us in everything that we do. So I can't recount for you how many times during the years that I've been involved with breast centers and therefore with multidisciplinary consensus treatment planning meetings that take place every week or every other week depending on the environment. What has happened many, many times is once the disciplines get together, there is an aha moment. You know, let's think about that opportunity, or let's bring that clinical trial to the table. Because everybody's sitting around the table, the options seem to be enhanced so often that one would say we're really not taking the best care of women without having interdisciplinary consensus treatment planning meetings. That's something that ASBD supports and hopes will continue to evolve across the country. It is the best standard of care. As I've talked to women who have come to breast centers, and I've had the opportunity to do that with really great frequency as I speak around the country, women are very clear. Coming to a site where there is a comprehensive breast center, they understand that means there is a whole group of people who are going to come around that table at the interdisciplinary team meetings who are going to talk about them, their circumstance. And that is both very gratifying and very comforting for women to know that when she hears back from her physician again, it is going to be with the enhancement of all the disciplines having talked about what are the best options that we can offer this woman. That's very comforting.